Yes. So in the last video we had done the theoretical psychology. The chapter we are learning about the branches of psychology. There are two branches are there. The one is the theoretical psychology, like where a psychologist is researching, establishing the principle and laws for the certain behavior. And here applied psychology. In applied psychology, whatever research we had done, we are going to apply in real life, right? We are going to apply in real life. That is very important for everyone, right? The knowledge and the principle generated through research in theoretical psychology are used to develop techniques to solve practical problems of individual, right? So here the knowledge and principle generated through research in theoretical psychology are used to develop techniques to solve practical problems of individuals, right? What it means that whatever knowledge and whatever principles are generated to the research in theoretical psychology, and here, like whatever research we had done, whatever information we had collected, that is going to be used here in practical life. Like take example, if just imagine if you are doing research on the student in your college, right? If you are doing research on the student on a college here, so what kind of research you all are doing? You are doing research on them, like why the students are feeling sleepy during the classroom. So you had said that the people are, so you said that the students are feeling sleepy because in the classroom the teacher are not interacting with them. That's the main reason they are feeling sleepy, right? So to break that thing, so to break that thing, we need to apply, right? To break that thing, we get the information and we need to apply it, that rules and regulation, like the so the students and so the students should get that that environment, so the student will not feel sleepy. That's it. You have information, you have to apply in your real life. like like we can say that you know how to use the mobile phone and you are using it, and you know how to cycle, you know how to drive. First you are understanding the information, okay, this is the brake, this is the steering, and then you are applying in real life, right? That's it. Okay, applied psychology. So through various branches uh, of applied psychology, psychologists are putting knowledge into practice. Okay, so we can say that the various branches are there in applied psychology, and what they are doing, they are applying psychology, they are applying, okay, psychologists are putting knowledge into practice so as to help individual and adjust their real life situation. So as I said before, like to help individual, they are they are applying the knowledge, they are putting the knowledge in real life so as to help the any person in real situation, right? In short, you need to keep in mind that in applied psychology, whatever information we had formed or we had created, it is generated or it is already there, that is going to be applied in real life. That's it. Okay, that is going to be applied. Now applied psychology is further divided into sub branches. Okay, so now we are going to see the applied psychology is also have various branches that we are going to learn now. So first is very important, as everyone know that like even you all are in this department, this field, education, right? You are in education, I am also in education field, so in education psychology, right? So you are also thinking that like education has also have a psychological department. Yes, they have, because in school system also there are so many psychological activity are happening, so that's why we have. So the field of education psychology examines and studies all factors are related to education. Okay, so here the field of education psychology examines, so the field of education psychology, what they are doing, they are examining and they are studying all the factors related to education, right? So in education psychology, all the factors they are studying and they are examining the which are related to education. It is concerned with increasing the efficiency of teaching and learning process. So why there is education psychologists are there? Their main concern is to study all the factors of education, because so they can improve the teaching and learning process, right? The education psychologist is concerned with developing effective methods of teaching, right? The education psychologist is concerned with developing effective methods of teaching and learning, right? So education psychology is concerned with what? It is concerned with developing effective methods of teaching and learning, right? It is concerned with what? It is concerned with effective method of teaching and learning. Clear? And preparing intervention program for exceptional children. Clear? So if I talk about the education psychologist is mainly concerned with what? They are mainly concerned with how we can develop the teaching process and learning process. Teaching process and learning. And they are using effective methods of teaching and learning. And what they are doing, like preparing intervention program for exceptional children. Intervention program means what? Exceptional children, like the children are who are not able to learn properly, so for them there is a programs, so special programs are there, okay, to help their learning process, okay. And developing personality development program, and they are intervention program, personality development program, then preparing a relevant curriculum for those exceptional children. And it is also concerned with the general problems of teaching and learning process, okay. So till now we have understood that education psychology is all about they are studying all the factors about and examining about the education related, and they are mainly concerned with how they can develop the teaching and learning process in the school system. And they are also focusing on the exceptional children, and for them they are having a programs like intervention, personality development program, and changing the curriculum according to their needs, okay. And they are also general education program, and it focuses on learning difficulties of slow learner. So they are focusing on the slow learner, because there are, if you see in the school system, there are slow learners are also there, and it focuses on learning difficulties of slow learner, exceptional as well as average children, okay. So exceptional as well as the average children, okay. So this kind of programs are there, clear. So they focuses on the slow learner, what kind of difficulties they are facing, from slow learner to average children, right. And they try to design the intervention program to develop motivation, effective and study habits, and better classroom environment, okay. So if you will see in education background, there are some psychological interventions are happening, and why the education psychologists are, it's because to fulfill the needs of the exceptional children, slow children, average children, and overall develop the teaching and learning process. And only the teaching and learning process will develop if there is a certain programs will going to be help the children, right. Educational psychologists are primarily associated with schools, college, and universities, okay. Educational psychologists are primarily associated with what? They are primarily associated with schools, colleges, and universities, okay. So they are actually working where? They are working in school, colleges, and universities, and they conduct a psychological test to provide guidance to student. So they are working in school, college, university, and they are conducting a psychological test. Why they are conducting? To guide the student, right. They deal with behavioral issue of children, such as, and this educational psychologists are mainly focusing on like what kind of learning difficulties are happening, right? Why the students are hyperactive, activity, lack of concentration, attention, ADHD, attention disorder, hyperactivity, attention, hyperactivity. Okay, now activity 4. Clear? Activity 4. So can you think at least one problem that education psychologist can find solution to concerning for the following areas? Like here what we need to, there are three problems are there, and we need to find the, we need to say that what kind, like what kind of solution the education psychologist will find. Just imagine for a minute, like you and me are education psychologists and we are going to find the solution. Okay, so basically they are saying that like can, like they can, like the education psychologists are able to find or not, that's it we need to say. But we just imagine from the education psychological point of view, so we can also able to answer. The first is the behavior of the student. Education psychologists, yes, definitely they can behavior of the student, right? They can study the behavior of the student and they can able to apply it, they can able to help them, right? Like just think about which kind of behavior in education the students have. The one behavior is obviously they are feeling very bored and sleepy, and when one more behavior like they are worried, scared, right? And how we are going to solve? So the teachers have to motivate those students, right? Then teaching methods, right? What method? Teaching methods, yeah, definitely they are able to solve it. Teaching behavior in the classroom, yes, because second and third, first one is the student perspective they can help, and second and third is the teacher point of view, so they are able to help the teacher for a perspective teacher also, right? Now we are going to focus on the second one. Second one is nothing but the clinical psychology. Yeah. So exactly what is clinical psychology? Clinical, first of all we need to understand the word what is clinic. Clinic, you have seen in your clinic like MBBS that there is a doctor. You are saying okay, let's go to the clinic because I have a high fever. Clinic is nothing but uh, basically it is related to hospital. Okay, so this clinical psychologists are mainly working in hospital industry only. Hospital, they have their own clinic, they are working there. It is also a part of psychology. Psychiatrists are also different, but they had done after MBBS year. A clinical psychologist is also related to when the person having a very severe problems like anxiety, depressions. Okay, so clinical psychologist is concerned with the, they are also saying that like they are mainly focusing on the diagnosis and treatment of emotional and behavioral problems. Okay, they are diagnosing, they are treating the emotional and behavioral problems like mental illness, like marital and family conflict, drug addict, severe depression, alcoholism, delinquency, etc. For the purpose of diagnosis, clinical psychologists collect detailed information about the client by using psychological test. Okay, by using psychological test, interview of the client and his significant other like family and friends, and they use appropriate psychotherapy to help the client to deal with the to deal with his problem. Okay, to deal with his problem. Clear? So here if I say clinical psychologists, they are focusing on how to treat the emotional problem and behavior problem like mental illness, marital and family related conflicts. In family also there are problems, so clinical psychologists are best. Drug addictions, when the person is having addicted with the substance, the clinical psychology. Severe depression, like with the depression you have but in a very severe level. And then alcoholism, the people are, and then delinquency, right, etc. These are for the purpose like they are diagnosing. The clinical psychologist collect the detailed information of the client by using the psychological test. So clinical psychologists were collecting the information first by using the psychological test, and they are interviewing it, and they are and is significant other like family and friends, right? So clinical psychologist will use the psychological test, interview with you, and they will interview with the family and friends to understand your problem, and they use appropriate psychotherapy to help the client to deal with his problem. Okay, they are using the appropriate psychotherapy to help the client to deal with his problem, right? They are helping the client to deal with his problem. Clear? They are helping the client to deal with their problem. Clear? So you can see also a photo over here. The clinical psychologist is here, and he is interviewing, collecting information, not treating. The clinical psychologist either work in hospital, like they will work in hospital, or they will work in community health center, or have a private practice. And this is the largest subfield of psychology, right? This is the one of the biggest subfield of psychological department. Clear? And this is very important department in psychology. Clear? So you need to keep in mind that uh, like we have understood that in education psychology they are mostly focusing on the uh, education related problem, and here in clinical psychology they are focusing on the higher mental disorder like mental illness, family related conflict, emotional. They are mainly focusing on the emotionals and the behavioral problems of the person, like what kind of behavior issue the person have, or emotional issues. And they are working in hospitals, they are working in community health centers, right? And this is one of the largest software. Now the third one is nothing but your counseling psychology. And counseling psychologist, you had heard this word, counseling, right? So the field of psychology is similar to clinical psychology, but counseling psychologist deal with mental behavioral problems. So it is similar to the clinical psychologist only. They are also dealing with the emotional and behavioral problems, but here the problems are a little bit milder than that, because in clinical psychology they are looking at this very severe problem, very last stage of a problem. Like here also they will look at the depression, but not that much, but they are very severe. Okay, so they offer guidance about adjustment issue faced by the person. They are guiding the person like how to adjust themselves. Like if you are facing a problem in your life, they will give you the solution, like you have to do this, you have to do that. Okay, counseling psychologist will be involved with the vocational and career guidance. They are involved with the vocational career guidance. Okay, some problems dealt by counseling psychologist are are related to issues and difficulty experienced by a person in studies, personal life issue, and workplace. So the main if I talk about counseling psychologist, main job is nothing but they are trying to understand the problems of a person, issue like in studies and workplace issues. In each and every life, in your stage of your life, you will face a problem in terms of your workplace problem, your personal life problem will be there. So you will approach you can approach the counseling psychology. You can approach the clinical also, but not that much, because clinical are more able to understand behavioral issue. So counseling psychologist will be the best. They will tell you like how to deal with the situation in a day to day life. Okay, activity 6. Activity 6, can you think of at least one problem that counseling, so the same way like can we think of like this counseling psychologist can find the solution or not. Okay, adjusting with the peer means what, like you are able to adjust with your friends. Yes, definitely they can. Adjusting with parents and siblings, yes, definitely, because family related issue they are studying about it, conflict, and making decision about career, yes, they will help, they will counsel. Okay, the fourth one is the criminal psychology, we will learn later now. Okay.